Hi everyone! In this video, we want to discuss the preferred antispasmodic agent for the relief of stomachache or other gastrointestinal problem in the elderly patients. If you love the elderly patients, please watch till the end of this video. As you know, elderly patients are more vulnerable to the side effects of the drugs. For example, medications with anticholinergic effects may actually worsen their conditions because these medications with anticholinergic effects may induce constipation, urinary retention, xerostomia, and many elderly patients are already involved with these issues. So, medications like hyoscine, dicyclomine, or propantheline are not actually the preferred agent for the relief of stomachache in the elderly patients because of their anticholinergic effects. But we have a medication called mebeverine that does not have any anticholinergic effects and can be used as an antispasmodic agent in this group of patients. Hope you enjoyed this video. Please like, subscribe, and share. Thanks.